Hi, everyone. Welcome back. This is Kara at the People's Harm Reduction Alliance and co-founder of Harm Reduction Doula Collective. So today we're going to talk a little bit about labor and delivery and planning for labor and delivery. So it's kind of a misconception that you can come up with like a birth plan. What I like to call is a care plan. So it is, where do you want to receive care? Where's your nearest hospital? Where do you plan to give birth? It's always good if you have access to a community doula, or if you are thinking about who your support people are, to look into where you want to give birth and how you're going to get there. So this could be, a mutual aid network is on standby and they're going to call you an Uber, or you have a friend or a trusted support person that's going to drive you. Or, if worst case scenario comes and you do not have any transportation and your contractions are coming 2 to 3 minutes apart, how are you going to call 911 and get an ambulance transfer? Sometimes if you end up getting an ambulance transfer, they're just going to take you to the nearest hospital. They may not take you to the hospital that you intend to birth at. And sometimes if you are out and about or away from the hospital that you intend to birth at, you don't have time to get there. So you'll end up birthing at wherever the nearest hospital is, and that's okay. This is why we say that we cannot come up with a birth plan, but we can come up with a plan of intended care so that we have kind of an ideal, a plan A, a plan B, a plan C, and we know what to expect if the first preference falls through, and we kind of can go from there. Same goes for what interventions you want to receive. So maybe you plan on doing a pelvic birth or a vaginal delivery, and you want to labor for as long as possible without any interventions, without a membrane sweep like we've talked about, without any Cervidil or Pitocin. But you can have kind of a list now that you know what some of these things are, where you're thinking, okay, like my plan A is that I just want to labor unassisted for as long as possible and do a pelvic delivery at the hospital. I want to make really clear the caveat that for folks who have Medicaid and have either a history of mental health or substance use, or active mental health and substance use, that insurance will not cover an out-of-hospital birth. So I have folks who have often asked, well, can I birth at a birthing center? And this is different from a birth center that's attached to a hospital. Some hospitals have their own birth centers, which is really just like their own suite that's kind of separate from their larger hospital, or it's usually like right across the street or nearby, that is specifically just for birthing babies and postpartum. The birth center that I'm talking about is kind of like a standalone birth center that's not affiliated with a hospital. So Medicaid usually, does not cover out of hospital births at a birth center or like a home birth option if you have a documented history of substance use or certain mental health conditions. So that's something to keep in mind. And I know that that can be really devastating for folks who are looking to avoid a hospital birth. But I hope that you can look into the comfort measures video and we can find some ways to work with how we can make a hospital birth more comfortable for you, and we can incorporate some of those things into your birth plan. Your care plan. We're going to hold myself to the same standards. A care plan, because ultimately this is about how you want to receive care, what kinds of care you'd like to receive, what you want to be the first course of action, and what you would feel comfortable moving to if that first course of action doesn't take place. So another example would be you've reached 40 weeks of gestation. So you've been pregnant for 40 weeks. Sometimes that can be hard to tell, but you might go to a prenatal visit and they're like, you're really far along. Have you been having any signs of early labor? Are you having any back pain? Are you getting any of those Braxton Hicks or like practice contractions? Are you feeling baby move? I might be checking some other things like how much fluid do you have left? How much space do you have left for baby to grow? And thinking we might want to start inducing. So if they're starting to talk about an induction, rather than just jumping in and scheduling an induction, would you be comfortable or would you want a membrane sweep first? Would you want to do Cervidil? If you do Cervidil or a membrane sweep, who is going to be around you to make sure that if you start to go into labor that you have a way of getting to the hospital and you're safe and comfortable while you are preparing for birth. So these are all things to think about. I don't have space in this video to go into the entirety of it, but we want to be thinking about where we're going to birth, what types of interventions or birthing assistant strategies we're looking for. Do we want to have coached pushes? So that means like when you're ready to start pushing, do you want somebody to tell you when to push or do you want to decide when you're going to push? And just because you put this in your care plan doesn't mean that you can't change your mind later. It just helps whoever is in your support system or your labor and delivery team know the types of things that you want so that in the event that you're in active labor, you don't have to explain to them all of the things that you're interested in not interested in receiving as care, or you have an idea of what you want before we are in the stage that it's time to go to the hospital. I want to also talk about care planning for pregnancy loss or abortion. So pregnancy loss and abortion or a pregnancy release, miscarriage, are still labor. So if you are planning to release a pregnancy or if your body begins to release a pregnancy, we still want to have an idea of who is going to support you during that time because you will experience uterine contractions depending on the stage in pregnancy. It can be quite painful. Contractions in general are painful, but the amount that your cervix may have to open to release a fetus is a birth. It is a birth, and there will be a recovery time. There will be a downtime. And so you want to make sure that one, if this happens, if you release a pregnancy spontaneously, if you have a miscarriage, how are you going to get to the hospital? Who can you call? What to expect when you get there. So they may give you some pain management. They may give you some misoprostol, which helps stimulate the contractions to make sure that you have a full release of your pregnancy. Misoprostol and mifepristone are two medications that are used both in abortions and in miscarriages quite often if a miscarriage isn't moving along with a consistent progress, because if a pregnancy is not viable, we want to make sure that the miscarriage, just like an abortion, moves through all of its phases completely so that we don't have any risk of infection afterwards, and the lining of the uterus and the fetus or the embryo is released completely, and then your body can re-regulate into its normal cycle. We also want to think about in our care plan just what kinds of emotional and mental health or even like other physical comforts we would like to receive, whether that's establishing somebody who might be able to bring you food or sit with you and help you process through your experience. Any type of labor experience, any type of postpartum experience, can weigh differently on different people and feel differently to different people. And so it's important to kind of have people that you might feel comfortable talking to, or have certain strategies for how you might want to receive comfort after that experience, whether that is, just having a safe place to go and to sleep, or whether it is, a playlist that you like, or sometimes it's having access to just like somebody's Netflix so that you can go and binge watch your favorite TV show. Having people that can check in on you, whether that's somebody who's staying with you, or just having people that are going to text you and check in and ask if you're okay, are all ways that you can kind of think about either before, during, or after how you want to plan for your care. I hope that this was helpful and that this gave you some good insight into thinking about what you would like from your perinatal experience. Also, just want to throw out there, you get to screen for whatever care you want. You can go check out one hospital. You're allowed to go do hospital tours beforehand, so that you know what things they have available. It can be on their websites as well. Sometimes with COVID, they're not doing in-person hospital tours. You get to decide where you want to receive prenatal care, where you want to receive your abortion care, where you want to receive your miscarriage support or pregnancy loss support. And you have the right to decide that you don't want that care at any time. So just because it's in your plan doesn't mean it has to stay in your plan. We can scrap it. We can go back to the plan. It's an ongoing, living, breathing plan. It can be written down. It can be in your head. It can be on your cell phone. However you like to plan and organize things is how you should plan and organize things. It's good to just bring people into that plan who you feel comfortable with, so that they can help support you in that during the entire process of your perinatal journey, or your pregnancy and birth experience. And these plans get to continue into that postpartum care. Anybody that has labored, regardless of whether it labors to the point of birthing a baby, is always going to be postpartum, and you get to have needs you get to have your needs before, during, and after. We're never going to stop having needs. We're human beings. So let's throw out any feelings of shame, guilt, or unworthiness that are attached to that, and step into it, because you are so worthy of support. You're so worthy of having choices, agency, dignity. And I hope that these videos mirror that back to you. I know that you are an expert in making your own decisions, and I trust you. I trust your process. Let me know if you have any questions, concerns, or comments in the chat, any suggestions. Reach out to me as always through Instagram, through email, on here, and I hope to see you soon. Take care. See you next time.